Hi, lifestyle changers. This is Dr. Edelita, yet again for another episode of my Sunday Drive. If you are looking for someone to guide you and help you, in some ways change the trajectory, change the story of your life, of your health, this is a perfect place to start. And join me in the next about 20 minutes. Today's topic is about diabetes. Before going to my topic, I would like to say that I'm very excited to announce to you that in less than 2 weeks, I will be hosting a live virtual diabetes masterclass. It is going to blow your mind, I tell you. I conceptualized this masterclass 2 years ago, but unfortunately, something got in the way, some twists and turns in my life that happened since. But this desire to teach a masterclass has never left my mind, nor does it ever, disappear from my heart. I was hoping I could launch it sooner, but nevertheless, I'm doing that in less than 2 weeks. It's going to be on September 29. So I hope that you can join me and make sure that you register. We will be posting the link for that masterclass here in this post. Okay. Well, have you ever had that feeling where the same thought, the same feeling keeps visiting you no matter what you do, no matter where you go, no matter who you are with? It's almost like an obsession, an obsession that you don't even think or choose to feel about, but it keeps coming. That's my thing with diabetes, especially with this course. And I prepared this one especially for you or for someone you know who might still till this day is suffering from diabetes, particularly type 2 diabetes. So why am I doing this masterclass? That question will be answered by the topic that I prepared for you guys today. Why am I doing this masterclass? Why am I so obsessed with diabetes? My answer is just simple. I know how it feels to be handed over a diagnosis of type 2 diabetes. I know how you feel. 6 years ago, I was diagnosed with type 2 diabetes, and I remember how worried I was knowing that my blood sugar had been creeping up several years prior to the diagnosis. And no matter what I was doing, no matter what I was trying, the numbers kept coming up. I saw my mom suffered diabetes, and I never wanted to go that route. Listen to this. This is not an over-exaggeration. Part of my mission to knock down diabetes probably sprung from this memory. My mom had checked off the list of all the complications of type 2 diabetes except heart failure, kidney failure, stroke, amputation. My most vivid memory of her suffering from the complications of diabetes was this. I remember watching the toes of my mom's feet, and let's just say this is her foot, okay? And these fingers are her toes. I remember vividly the toes of her foot would hyperextend and twist on its own as if her toes were invisibly pulled by some kind of force in different directions. And it was so painful. She would cry and she would beg. To me, that was kind of a traumatic visual, even though then I was already in medical school, but I couldn't do anything. couldn't do anything but tell her, you need to control your blood sugar. Her neuropathy or nerve pain was so bad that she'd cry. And she also was almost got blind from retinopathy. She became obese. The side effects of her medications were becoming so frustrating since her blood sugar would crash and then it would shoot up. If you're a diabetic, you can relate to that feeling of crash and rise of the blood sugar. It can really make you feel so uncomfortable. Now, her money also flowed like water to the pharmacy because we had to buy her bag full of medicines. Despite those, her blood sugar was still uncontrolled. I was not only worried, guys, that I got diabetic, I was also scared. A US trained medical doctor, scared of diabetes? But that's the truth. Do you know why I was scared? I was scared because it was not only me who got diabetes, but also my husband, who's also a doctor. At both 37-year-olds, doctors, US trained, supposed to know everything, right? Now with type 2 diabetes, and didn't know what the heck was going on. You know what made me even more scared? It's also the fact that we had two young, still young, then 8-year-old twin boys who are depending their lives on us. We were this sick 37-year-old parents. Isn't that the scariest thing in life? When you know you are in a bad situation and it's going to get worse and you don't know what you are doing wrong. To me, that's the most scariest part of that chapter of my life. Sure, I can start on medications. No problem. Not a big deal, right? I am a doctor. I do that every day. Put patients on medications, prescribe medicines. That's easy, right? What's the big deal? Call me overly dramatic, but diabetes is not something you should take lightly. Just because you feel nothing doesn't mean it's not slowly taking away your life. Again, just because you didn't feel anything doesn't mean diabetes is not doing anything. I can guarantee you that as you are sleeping, talking, laughing, praying, enjoying, this diabetes is like a sneaky little thief that is going to slowly but surely take a bit of your kidneys, a bit of your heart, a bit of your liver, your brain, your eyes, your nerves, and anywhere your blood can flow. Now you tell me, why should we not take diabetes so lightly again? I'm going to explain more about diabetes in my free course. But for now, in this live, we're going to answer two questions that I bet it has also come across your mind too. The first question we're going to answer today is, what's my risk of developing type 2 diabetes? And if you've already had diabetes, then you can go back, trace back, and then you can say it all makes sense. The second question we're going to answer is, what can my life look like if I'm diagnosed with diabetes now? You see, diabetes is the most common cause of kidney failure, non-traumatic amputation of your toes, feet, and legs. It can also be, and the most common cause of heart disease, heart attack, stroke, and decreased blood flow that eventually will lead to amputation of your legs. Now, the first question is, what's my risk of developing type 2 diabetes? I think that we can better answer that question if I show you guys this graph from CDC. It's from the Center of Disease Control. Now, I'm going to explain to you what this means. And then, remember the first question, what's my risk of developing type 2? What's my chances of developing type 2 diabetes? So in this graph, you'll see what they did is that they looked at more than 500,000 patients aged 10 to 100 years old who had gone to the emergency department from the years 2011 to 2015 in New York. And then what they did is they looked at the age distribution with type 2 diabetes by ethnicity. So there are 4 ethnic groups that are charted here, you will see different colors of your line graph. The first one is, the highest one is the blue line, representing non-Hispanic black. Next is the orange, which is your Hispanics, and the gray is for Asians, and yellow for non-Hispanic whites. Now, let's look at where they started. 10 years old, right? They charted 10 to 100 years old patients that were diagnosed with type 2 diabetes. And if you can see here, at 10 years old, you already can start seeing children developing type 2 diabetes gradually, slowly, but gradual. And then when they hit 30 years old, young adults, you'll see a much more steeper slope. And it continued to be steep until they reach 80 years old. That's when they see a decline in the diagnosis of type 2 diabetes among 80 plus year olds. Now, this pattern, as you can see, is similar to all non-Hispanic blacks, Hispanic, and Asians alike. There is a much less steep slope for diabetes diagnosis in non-Hispanic whites. So what's your ethnicity? What's your race? You can tell. Now, when I saw this graph, going back to my history, I was diagnosed diabetes at 37 years old, right? So 37, that was the start of the peak increased risk of type 2 diabetes. And that really made sense to me, you know. Now, if you think you're going to live till 80 years old, please know that your risk dramatically increases with age. Okay. So, this will perhaps give you an idea, depending on what age you are. Now, this is again just from 500,000 patients in the U.S., and particularly in New York. But from this data, we can extrapolate, we can infer some insights that can be applied to us. And I can guarantee you that type 2 diabetes is not just about hereditary factor. Not because you don't have a family history of type 2 diabetes and you won't get it in your lifetime. No, it's not hereditary. It can increase your risk, but you will have the same risk as those with family history, because type 2 diabetes is lifestyle, really lifestyle driven and dietary driven too. Okay, so that is the first question, right? What's the risk of developing type 2 diabetes? Now, the second question that we're going to answer today is, what can my life look like years from diagnosis of diabetes? When you say what my life look like, living with diabetes, please know you're talking about the complications of diabetes. Since diabetes is a silent disease, you usually don't have typical symptoms. And by the time you have noticeable symptoms, you are already experiencing the symptoms of the complications that had set in from the uncontrolled diabetes. Now, I have another graph to show you to answer that question. Complications of type 2 diabetes, because this is going to dictate the quality of life that you're going to have from the diagnosis of diabetes. So this graph, okay, now by graphing how many patients develop each complication rate per year, starting 1 year after the diagnosis, we can see that most patients develop complications too quickly, right? So here you have 6 color legend. What are these? What do they mean? So here we have orange for heart failure, the light green for kidney failure, dark green for liver disease, orange for myocardial infarction or heart attack, yellow for retinopathy, where you will get permanent blindness, and stroke. So already, first first year anniversary of your anniversary with diabetes, you can have any or combination of these complications. And you can see how high your risk is from getting any one of this. And as the years go by, the possibility of developing those complications are still present. Now, you'll see that it's about, 15 years later, you can tell your risk has significantly diminished. But it depends. Like if you're diagnosed at the age of 50, right? 15 years later, you're 65. What made me think that it can drop this much is because of the question, well, are we sure that those diabetics diagnosed can still live up to this much number of years? My mom had retinopathy, or, as I've mentioned, right, almost got blind, but we got her blood sugar under control. So that stopped. She also had neuropathy. Now, this is not just the only complications you're going to get. This is just a sample of what they had monitored. But there are many still complications like frequent infection. Mom had that too. You can be depressed having this because the symptoms of the complications can be out of this world, can be an out of this world experience that most people really don't like. So another question that may come across your mind is, now that you know what are the complications and how soon can you get those complications, right, from that graph, maybe you're also going to be asking, can I actually choose which complications I can get? No. Will I just have one complication? Unlikely. Realistically unlikely. It's usually a combination. Can I possibly know when I will start getting these complications? I hope you remember that chart. Now, I hope that chart gave you a perspective of what your life can look like after diagnosis of type 2 diabetes. If you have type 2 diabetes or pre-diabetes or know of somebody, I'm sorry, and if you're watching this, I don't mean to scare you. This is to empower you. My purpose of diving deep into that information, that data, is not to scare you at all, but to motivate you, to give you hope. Because the good news, guys, is that diabetes can be prevented, can be effectively managed, and be potentially reversed by adopting a healthy diet, a healthy lifestyle, a healthy mindset. I know this to be true because I reversed my diabetes, and until this time, and still till this time in my journey, I am trying my best to keep that silent. I am trying my best to keep it reversed. And now I'm helping many diabetics control their blood sugar and reduce the need of medication, because this is the most sensible thing to do. Why suffer when you can choose to be free and let go of anything that can tie you down and decrease your quality of life? So this free virtual diabetes masterclass on the 29th of this month I'm hosting is a 3-hour event packed with simple and actionable tools that you can use immediately. In this masterclass, I will show you why type 2 diabetes can not just be controlled but also reversed. I will teach you how to provide the best environment for your body to heal naturally without starving your body using in very expensive medicines and supplements. And I will also be sharing my secret sauce to staying motivated so you can get consistent wins over diabetes. I have to say that starting out with a healthy diet, healthy lifestyle, healthy mindset is not really difficult. What's difficult is staying on it for a long period of time. Because the problem with us humans regarding healthy lifestyle change is not that we're lacking motivation. Because if you're still watching me till this point, I tell you, you have the motivation. Otherwise, you wouldn't have stayed. You wouldn't have watched till this point, right? You are motivated. It's not also that we don't have the time, we don't have the money, you don't know what to do, right? You and I know that all these are not true. Who are you kidding? Me? Yourself? Because the truth is that, and I know you agree with me, the truth is that in anything in life, if it is essential to us, we will find a way. If it's not essential, it's not important, we don't put any value to it, don't put value to our health, guess what? You'll find excuse or excuses. So at this time, do me a favor. Drop all those excuses that you have in mind, drop them all, and look at what's left. What's left is the reality staring at you, begging the question, how important is my health to me? How important is your health to you? In this masterclass, I am not promising you any instant results. No. If you're looking for a one-time simple scheme, this is not for you. But I promise you to give you the tools and the knowledge to effectively lower your blood sugar and keep it that way for as long as you want, because it's only by keeping your blood sugar consistently controlled can you reverse diabetes and prevent complications from setting in. If you do it that way, the way I did, I promise you, you will feel better. You will live happier, more fulfilled, and save more than 50% of the medications that you are spending right now for diabetes and for other health-related diabetes expenses. Okay? So there's no better time to take action. Do it now. Click the link that we're sharing with you in this post. Attached to this post is that link where you click and you'll go to our page where you can register for this masterclass. Do it now, and I'll see you in 2 weeks. Again, this masterclass is free, and everyone is welcome to join. Share. Please share to those you know are struggling, wanting to take control of their health. The link below will give you the details of this event, and but feel free to reach out to us. Drop your question in this post as well if you do have any. This event requires pre-registration and has limited spots. So, hope you'll make it a Sunday routine, guys, to join me every Sunday here in Lifestyle Changers MD. I'll talk to you next week. Bye.